Good morning, and thank you for joining us this morning for the Altron Technology Day in partnership with Brainstorm Magazine. My name is James Francis from Brainstorm Magazine, and I will be facilitating our discussion today about a very, very interesting topic, the future of healthcare. Before we get started though, I would like to remind you that this is an interactive session. You can submit questions on the Q&A app. We will have a presentation from our two esteemed guests here, and afterwards we will have an opportunity to answer some questions and answers. Ask some questions and we'll get some answers. Today we're talking health. Health is an incredibly interesting topic for modern technology. When you look at what futurists predict, health and energy seem to be the forces that will shape what we have tomorrow and in the ongoing days. And therefore it's very important to see what is the technology in healthcare, how are we going to get to these ambitions, and what can you expect in terms of going to a hospital, a clinic or a doctor in the future. Talking to us today is two gentlemen from Altron Health Tech. Next to me we have Andrew Brown, he is the Operations Executive, and then also Dilip Naran, he is the Strategic Business Development Manager. Thank you for joining us, gentlemen.
Thanks for having us.
Andrew, you've got a presentation for us, after which we'll have a short Q&A, and then Dilip will also have a presentation, and then we'll conclude with another Q&A on this. So without further ado, Andrew, thank you.
Thank you very much, James. Right, well, good morning, everyone, and thank you for joining us. So what I thought I would do is talk about the digitization of the patient journey as an illustration of some of the work that we've been doing at Altron Health Tech. As we're well aware, the pandemic, the COVID-19 pandemic, has had a remarked impact on particularly healthcare in South Africa, and the result has been is that the healthcare providers that we provide technology to have had changing circumstances which have demanded a different reaction. And I thought the best way to illustrate this is to actually look at a patient journey. So I started off with the traditional patient journey. We've all been ill before. So imagine you wake up in the morning, you're feeling a bit ill, you pick up the telephone, you phone the doctor's practice, you make an appointment, and at the appropriate time you get into the car and you head off to the practice. You walk into reception, and the first thing that happens is you've handed a piece of paper that you have to fill in. So you've got to fill in that form and you put in your demographic details, etc., and you hand that to the receptionist, who then captures that into the computer that is sitting next to her. At the same time, if this is the first time that you have visited this particular practice, they will create a paper file for you, and that is going to be your health record. And in due course, the doctor calls you in. He or she has that file. They do the assessment, the diagnosis, etc., and notes are written on that file. And then after that, one of two things happen. Firstly, you go back to the reception and you either pay, or the invoice for your consult is submitted via a switching house like the one that we have, MediSwitch, through to the medical aid in order to pay the doctor for the consult, or alternatively you pay and then you take that piece of paper, you scan it, and then you send it off to the medical aid yourself to get that money back. The other thing that happens is the doctor would have written out a prescription for you. You take that in your car off to the pharmacy, you hand that in, and then the pills, etc., are dispensed. But in the world of a pandemic and this reluctance of patients to actually even want to go into a practice, or actually maybe to even go to a pharmacy, how have things changed? And what we have seen and what we've needed to respond to as an organization is that the patients, one, are looking to find ways of booking online. So we're providing online booking systems in order for a patient to go and find a practice on the web, find a slot, book the slot. And then an interesting dynamic which has come through, and I'm going to talk about this a little bit later as well, but is there now the need to actually facilitate online payment. That was never really an issue before, because quite simply the patient was there in the reception of the practice. Now the patient isn't coming anywhere near the practice, so how does the doctor make sure that he's going to get paid? So if it's a medical aid patient, fair enough, then that will get processed. But what we're also having to do is put in mechanisms in place to allow the patient to pay up front, and there are all sorts of new payment mechanisms coming through in the market that we're needing to start responding to. The other thing that is possible is to complete details online. If there's a need to speak to a receptionist, perhaps it's a video link, maybe it's a telephone call. But the one thing it does do And by putting the workspace for the receptionist into the cloud, so to speak, one of Altron's key drivers, is to ensure that the receptionist can, in fact, be working from home or at a different physical location from the practice and from where the doctor is. Okay, so we've certainly seen a big demand for our cloud-based practice administration systems, and equally so, that electronic record also needs to be digitized now, because in order for the doctor to be able to access that, whether they're at home, in the practice, or at some other location, it does make sense that they can just log on, view that particular thing, capture all of the details of the consult, and be able to refer to it later, as well as be able to share it with a colleague who might now not be sitting in the same physical space. The consult happens via a video link, and we enable those telehealth virtual consults. So a doctor can have a discussion via Zoom or Skype or whatever with the patient, and then the processing of the claim can continue as it did before, either be submitted through the switch to the medical scheme, otherwise it's already been paid. And then the other thing, of course, is an electronic prescription. The doctor can actually create the script, we can get it sent through to a courier pharmacy, and then the drugs will arrive at the bottom of the driveway. So this doesn't speak to an entire journey, of course. It is very much simplified, but I think what you can see is this thing has changed significantly as a result of both patient and doctor not necessarily wanting or seeing each other face to face. Some of the examples of new payment mechanisms that certainly we've seen coming through, we already do an integration into a product called MediBucks, which is a wallet to help patients save for monthly medical expenses. And the fact of the matter is that they can use that wallet of savings to pay the general practitioner or whichever doctor they've seen. Recently, Netcare has released a voucher, which you can buy via FNB and the FNB app. And effectively what it means, it's a prepaid mechanism to go and do a consultation with the doctor and to pay the doctor. Now, of course, from a technology perspective, this has some complications, because we need to make sure that when the voucher is presented, that it's valid and that the doctor does receive the value for that voucher once the consult has been concluded. And then just recently, last week, Discovery launched a very similar idea. Okay, it's still very new, but one of those items actually talks about the prepayment of a virtual consult. So they are certainly pushing this idea along the way as well. This graph shows, and we get this from our claim switching information, and it's for the last 12 months, and you can see that November, December, January of last year and early this year, the number of virtual consults was basically nothing. It was less than 1%. And then suddenly COVID-19 pandemic hit, and you could see the impact of patients asking doctors, can we please now start doing, and this data is based on the claims that we're seeing coming through, and you can see certainly in July a marked uptick in the number of virtual visits. Now, that is around 8 or 9%. Okay, so it's certainly not the whole picture. There's still the actual physical visits happening, but it does point to a trend, and one that I think this horse is bolted. We're never going to get it back in the stable, and this speaks to future enablement of virtual consults going forward. The other thing that the whole virtual interaction raises, this interesting thing, is how do you know if the patient doesn't actually appear at the clinic or at the practice that the patient is the patient? How do you know that the patient hasn't just provided their medical aid card to their brother or their sister and they are pretending to be that individual in order just to get that particular consult paid? So we are looking at and developing facial recognition software with the intention of being able to validate both the patient and the provider against a pre-enrollment database, so that when we submit a claim through to medical schemes, we can actually say to them, listen here, we've been able to verify that the patient is the patient, that the provider is the patient, and when you get this claim, it is in fact a valid claim, and all of the data packed in it, you can trust what you're getting. I think the other thing that we are seeing through this whole digitization process, and maybe we are some way off this, but certainly it's going to provide significantly more patient empowerment, in terms of access to their own health records, the ability to provide patients with more targeted education, that these platforms are certainly providing the communication and coordination effort for care between the payer, the medical schemes, the provider teams, the doctors, nurses, etc., and of course the patient. And they can interact, particularly in the case of chronic care, more effectively around the care of that particular patient. The other thing with Poppy coming in, and they're wanting to share medical records, now that they are digitized, they're in the cloud, so to speak, it's important that we get patient consent to ensure that the patient is saying, yes, that doctor may see my record. And then finally, I do think that with this empowerment, we're going to see patients start to be more actively involved in actually managing healthcare costs. I think as we're going through this economic dip as a result of the pandemic, money is tight, and I think patients are going to become more and more aware of what they're spending from a healthcare perspective. Now, I've been pretty much speaking to the sort of private sector area that we certainly don't ignore public. And we've got solutions, particularly private care, healthcare solutions that use similar technologies to what I've been speaking about, where we have a system that we're able to enroll patients onto our electronic system using biometrics, that we're able to verify them against the master patient index run by the Department of Health, and it's hosted by the CSRR. We're able to record the clinical encounter with either the nurse or the doctor in an electronic patient record, that diagnostic services like labs, radiology and stuff can be ordered, and that pharmacy drugs can be dispensed and recorded. But I think the most important thing of this entire continuum is that it allows the powers that be who are worrying about health in a district or in a province to be able to manage population health, because quite simply you're getting that global reporting of what patient visited what clinic, when, with what condition, and what drugs were in fact dispensed to them. And James, that's my story. Thank you.
Thank you very much, Andrew. And very interesting. I mean, it's actually such an opportune time to talk about healthcare, both in terms of the pandemic, which we'll touch on in a minute. But I would like to start with this confluence of technology and the solutions we can bring. A lot of these seem like old problems. Is it just a question that everything is converging now that we can do these things? Has it been slowly built up? Basically what I'm asking is, why now? Why are we seeing these breakthroughs in medical healthcare at the moment?
Yeah, James, I think that the best way I could perhaps illustrate that was I had coffee and a meeting with one of the CIOs of a pathology lab, and he spoke to the fact that pre the pandemic they'd put a lot of effort in trying to get an interface between themselves and the National Health Laboratory Services. Okay, and they've spent over a decade trying to get that right. That when the pandemic hit, it was up and running within 3 weeks. So I think the ideas have always been there. I think COVID-19 has just accelerated everything. So I don't think anything that I've presented up there is necessarily new in the sense that ideas have been working on. It's just that it's been accelerated tremendously over recent times out of necessity.
And looking at the pandemic's impact, what did it expose about it? You and I had a bit of conversation before this about what we thought was a priority prior to the pandemic and what became a priority after the pandemic in a technology sense seems to have shifted quite a bit. Has the pandemic exposed certain flanks to healthcare that people now realize, okay, we need to address this. This is not a luxury or something we can kick down the road?
Yeah, that's interesting. Yeah. I think the one thing that it has exposed is the collation of data about healthcare from a population perspective. I think that we as a country had to really scramble to bring data to get data together in order to understand the impact of the pandemic and where it was spreading fastest and most, etc., etc., etc. So I think the kind of the impetus to start digitizing and getting electronic health records there to facilitate the flow of clinical data to better manage population health certainly has been one of those that has exposed us a bit, I believe. But not just South Africa. I mean, I think many countries around the world. Yeah.
That's a good point, that because this is a global pandemic, we've had many different use cases from around the world, and seeing, we could probably test what works very well and what doesn't work very well. One of the things that really exploded, as you said, there's telemedicine. We went from nothing to quite big numbers. But isn't that a little bit impersonal? I mean, we're all on Zoom these days and Teams and such, and I can't always associate that with a doctor's consultation. How would you unpack that? Are there ways to make telemedicine the same or very close to a physical consultation?
Yeah, well, I think the first thing I must point out is that the guidelines from the Board of Health Funders is that if it's a new patient, okay, there needs to be a physical meeting at the first consultation. Any subsequent consultation can be virtual, so at least there has been one interaction. Okay, but if we're thinking sort of like post-COVID, I think the use of this technology, certainly from an efficiency point of view, and more effective use of medical resources in South Africa, and this has been envisaged for a while, but I do believe this has now been the impetus, is that a patient can go to a clinic, see a nurse. If the nurse needs to then consult with the doctor is available via a telehealth session, and that doctor is able to provide consultation services to many geographies in the same morning or day. And that, I think, will be a far more effective use of that resource in the country, and allow sort of greater reach of healthcare to those people who actually need it.
Now, for that to happen, though, we need this to spread across the healthcare industry. It's got many tiers, many, let's call it almost verticals within itself. Let's look at ratification of a patient, trying to identify a patient and the payment and so forth. Where is that going to grow from or extend from? Because eventually, if this does not appear both at the insurer and at the private practice, it's going to be of limited use. Is it a ground-up approach? Is it a bottom-down approach?
Yeah, I think, yeah, okay. I think the main beneficiaries and drivers would be the medical schemes and the administrators. It's in their interest to make sure, it's about fraud prevention, and they're always, worrying about that problem because it does happen, and it has been on the increase over the last few years. And from their perspective, they would very much like to be able to verify that the patient is indeed the patient. It's a conundrum they've been battling with for years. So I think the driver is going to come from there, but it needs to be in partnership with the doctor, because if the doctor is why would the doctor sort of take on that extra hassle of doing the verification if they're not going to really benefit from it? So I think it needs to be a cooperative exercise, whereas we as a technology provider can provide that middle role and allow the schemes to almost incentivize the doctor to say, if you send us verified data, perhaps we will pay you a bit more for those particular consults.
Thank you. And I think to wrap it up, let's just talk a bit more of the accessibility of this technology. You mentioned cloud platforms being a play in this. Adopting this type of technology, perhaps affordable for the large guys. What about the smaller guys? What can the market expect and how they can adopt this technology? What are their options in terms of a platform world?
Well, I think the beauty of going the cloud-based is that it is accessible to any level, because simply it's a question of we tailor our solutions based on the size of a practice and the complexity of what they're looking for. So, yeah, it's not in my opinion, that isn't really a barrier. In fact, cloud computing actually makes it easier for smaller practices to participate in the same technology as larger corporate organizations.
Thank you. And then we have a question from our audience to wrap on this side. Will these technologies help build the relationships between patients and doctors? Are these going to empower patients and create better healthcare management?
Yes, I think that's what speaking to the concept of becoming more patient-centric, and I think that if we look at the traditional relationship, the power has always been, from a knowledge perspective, is with the healthcare provider, the doctor, and then of course, from a financial perspective, it is the medical schemes, and the patient has always been quite peripheral to that. They pay what they're told to pay, and the doctor tells them, you know, what they should be doing. And I think through better patient education, better access to records, better access to their own clinical information, taking control of their health from that perspective, I think this whole digital world actually starts to transform that and actually sort of almost levels the playing field a bit from a patient perspective. So I think that's exciting and empowering.
Thank you very much, Andrew. We can talk a lot more about this, but I want to swap over to Dilip Naran, who's going to talk a bit more on occupational health and safety, a much more, not more, but a very pertinent part of this conversation. So over to you, Dilip.
Thanks, James. So I'm going to talk about Altron HealthTech's occupational health solution, and this solution was really born out of specific pain points that many organizations have felt in their quest to comply with the Occupational Health and Safety Act of 1993. So what are these pain points? These really relate to tying up disparate and manual systems, ineffective reporting, and a lack of automation. So what many companies went ahead and did in order to try and comply was really just to add more administrative functions, individuals that would collect data and data capturing and utilize spreadsheets to kind of meet the compliance requirements. This has actually resulted in a situation where many organizations have a fragmented and onerous healthcare system. And what our solution does really is help organizations move away from that to moving into a greater and a more efficient system. So in terms of our value proposition, first and foremost, our solution is really there to ensure that the healthcare practitioners, the nurses and the doctors, are utilizing best medical practice in terms of how they produce or how they do the work within the actual clinics that they work in. Further to that, obviously there's compliance to clinical standards and protocols, and then overall all of that, over and above that, ensures that we are also complying with the Act. So in developing our solution, we looked at the patient journey. And in this specific instance, we looked at the employee journey. And I'll talk through each of these particular points because they relate to how we've innovated and how we've solved specific problems. And those are the pain points that I was actually referring to. So the journey starts off with a booking. Prior to organizations moving onto our systems, if you'd been to any one of these clinics in perhaps their mind, you'd see a long queue of people, let's say 7 or 8 o'clock in the morning, and they're all waiting to have their medicals done. And that was really inefficient. It led to loss of productivity within the organization as well. And our booking and scheduling system has solved that problem. And it's as simple as a manager calling the clinic and booking an individual, an employee, or it could be as complex as managers and supervisors utilizing an online enterprise booking system to book their employees or their staff on for the types of medicals that need to be done. So as we move forward and into the arrival process, it's a very important process, and the most important part of that process is really ensuring that we're identifying the individual. We need to know that the person who has presented themselves there is in fact the person that we're supposed to be dealing with. And that we do via biometrics, and I'll talk a little bit about that a little later in my presentation. So the fact that we know what type of consultation this individual is arrived for, that triggers the workflow associated with what must be done in the actual occupational health encounter. Our system drives the actual process, and that process is a fairly complex one because the individual would have to go through multiple workstations. You'd have to have your vital signs taken, then you'd need to test your vision amongst other tests. And as all of that is happening, our solutions also managing all of the supporting processes that take place whilst this is happening. And that includes managing stock. So obviously as you're consulting with patients, there's PPE and drugs that are utilized, and we keep track of that. In addition, every activity is costed. So by the time this is complete, the organization has a pretty good idea in terms of what the cost is associated with this process. So once the individual has been through all of the various tests within the actual clinic, the healthcare practitioner or occupational medical practitioner is then presented with a summary, and any abnormalities are highlighted. And on that basis, the doctor can go ahead and certify for fitness. That's an automatic process. It's an electronic process. A certificate is issued, and what that does is it automatically updates the HR system, and at the same time, it also updates the time and attendance system. So if an individual has actually failed the certification, that individual won't be allowed to enter the workplace. And that could be the factory floor or mining shaft. So I'm going to talk a little bit about some of the other key features of the solution. At Altron Health Tech, we built a powerful integration platform to be able to deal with all of those disparate systems that I referred to in my opening. This includes industrial diagnostic devices such as audiometry, spirometry, vision, X-rays, and so on. And in addition to that, there are other applications as well, such as HR, time and attendance, biometrics, and so on. And we, through our integration platform, ensure that we securely exchange that information and store that information securely within our electronic health record. And that's really key to ensuring security and confidentiality of data, and also meeting the requirements of POPIA or POPIA. So moving on, since we collect so much of information within the actual application, we're able to report extensively on what is happening with the workforce of a specific organization. So we can do activity-based reporting, and that helps with KPIs, so we can understand and we can benchmark individuals against each other. How long does it take to do a certain consultation? We can report on a specific patient, and also population stats. And this is quite interesting because organizations now have a view in terms of what their workforce looks like from a health perspective. And examples of that could be 17% are hypertensive, 20% are diabetics, and 40 or 45% are obese. So that's the kind of information and valuable information that we get out of our solution. So one of the key drivers for companies to purchase our solution is really around compliance. But in addition to compliance to the Act, we work in very specific verticals such as mining and manufacturing, and we're able to provide very specific additional reporting that relates to mining or manufacturing. The other very important thing is that these large organizations are often subject to spot checks by the Department of Labor, and these audits require extensive reports to be presented, and those companies that utilize our solution essentially have all of this information available in real time. So I want to talk a little bit about screening and return to work. In March this year, South Africa saw its first COVID-19 patient, and the effect of the lockdown and the risk-adjusted strategy imposed by government has meant that many organizations, in fact all businesses, needed to comply with ensuring that the workplace was safe. And that process really entailed screening each individual that entered the workplace and ensuring that those that were not allowed to spread any or contaminate the work areas and so on. So this particular process, especially for large organizations, is quite onerous. You need somebody to physically take the temperature. You need a questionnaire to be completed. That means using paper, using pens, and that creates all sorts of situations where the virus can be spread. So what we did at Altron Health Tech is we've, together with our colleagues at Managed Services, we've really integrated our solution with the Hikvision thermal scanners. And what this does is it really enables us to identify individuals using facial recognition, as well as take the temperature. And I'm going to use the next slide to really describe this process in a little more detail. So as the individual arrives at the workplace, they'll present themselves to this tablet-looking device. They will be identified. Obviously, identification can only occur if the individual has been enrolled, so there's a reference point. The temperature is taken, and it also warns you to wear your face mask if you're not wearing a face mask. And then there's the question of the actual completion of the screening form. And what we've been able to do with this particular device is present the actual questionnaire on that device, and we can basically answer the questions simply using wave actions. So if the question is, have you been in contact with somebody who's COVID positive in the last 14 days, the answer options are either yes or no, and one would simply swipe to the right or swipe to the left, and that would indicate yes or no, without actually touching the device. So we've solved the problem. And basically our solution would then make a decision in terms of, is this individual allowed to proceed to the work area or follow a isolation process? So in closing, I'd like to really just share with you some of our customers. As I mentioned, we work extensively in the mining space. and in the manufacturing space. Andrew spoke about the city of Johannesburg, that's public healthcare, and then the likes of Netcare uses our solution to support their customers as well. Toyota has been around with us for almost 10 years, and we've been through a journey with them. As and when issues arise, they've called on us to say, we've got this problem, how do we solve it? And through that process, we've enhanced our product to provide additional functionality for our new customers as well. And that really just demonstrates the Altron ethos of being there when it matters. So what I'd like to do is really just close off with a short video which will summarize everything that I've covered in my talk.
The future of occupational health with Altron Health Tech. Health and safety oversights and poor record keeping have a long-term impact on company profitability and sustainability. A study conducted at a South African gold mine found that during the early 2000s, thousands of production hours were lost due to expired health certificates that prevented miners from going underground, all due to a manual system that could not keep track of all the variables. To make health and safety work is a complex matter, mostly because there are so many disparate systems in the chain. Altron Health Tech offers a solution to this problem by integrating all these systems. Typically, organizations are faced with multiple disparate and often manual systems that are inefficient when it comes to reporting. Additionally, the lack of automation can result in non-compliance to the Occupational Health and Safety Act and other industry-specific requirements. Altron Health Tech has developed a solution that can now enable organizations to meet their occupational health and safety compliance easily. At the same time, our solution ensures an efficient work environment. Integration is the true superpower of Altron Health Tech's Electronic Health Record, EHR. By integrating an employee's personnel file into the electronic health record, a single source of truth is ensured. Based on the workplace medical surveillance matrix, each worker has an individualized risk and monitoring profile against which health checks must be scheduled, carried out, and reported on. The electronic health record has details of the risk exposures, and an automated action plan drives the workflow process to ensure efficient processing of the employee through the clinic. Furthermore, as the employee moves through different workstations in the clinic, data from diagnostic devices are integrated into the EHR automatically. At the end of the testing process, the occupational health doctor now has a summary of all the important parameters, allowing the doctor to create a certificate of fitness. Linking into time and attendance, the system ensures only employees with valid health certificates are allowed back into the production environment. Altron Health Tech's EHR solution collects data from multiple endpoints, allowing for extensive reporting, which can be generated at a population and individual level. By having reports at your fingertips, compliance requirements can be easily met. Compliance with the Occupational Health and Safety Act is inescapable and can be a competitive edge instead of a costly and time-consuming management headache. As a trusted healthcare technology partner, Altron Health Tech has the solution to ensure that companies have the tools to improve productivity and employee well-being well into the future. Contact Altron Health Tech to improve your productivity and take the headache out of occupational health and safety compliance.
Welcome back to our conversation on the future of healthcare, or can I rather say the now of healthcare, because all of this is happening right now. Before I continue my questions, Dilip, I just want to answer one question from the floor. Yes, the videos produced right now will be available online later, so if you do miss anything, we'll always be there forever in digital form. Right, thank you, Dilip. That was a very interesting conversation on occupational health and safety. And my first question, though, would be that you spoke of mining, you spoke of manufacturing. They are on top of OHS in a lot of ways. obviously the pandemic gives reason to change, but are there reasons beyond that why they should adopt this? Why is what they have right now not good enough?
So thanks for that, James. You're right. Actually, most of the large organizations have these specific pain points that I actually referred to. However, what the pandemic has done is it's highlighted to all other organizations as well that this is not just for a large manufacturing company, but any organization that has to ensure compliance to the Act and keep the workforce safe. So we're likely to see other pandemics in the future. What we've seen in the last 6 months is great interest from small organizations to move on to our systems such as ours. And we've whilst it's presented as an enterprise type solution, we also do cater for those smaller organizations. And I certainly believe that what this pandemic has done is it has highlighted the need for health and safety within the organizations.
Now, you mentioned in your presentation compliance came up, and obviously for manufacturing, mining, I know a lot of people's health has been reduced because of compliance. But what you just suggested is this can be applied to many more verticals, and they all have their individual nuances. And I'm sure there's somebody listening to this saying, this sounds great, it's a platform, I can access it. But can you really align with what my industry needs? How would you answer that?
So James, the answer to the question is our solution is not a shrink type solution. It's not buy off the shelf. We engage with our customers. We understand their specific requirements. Yes, the core application is essentially our electronic health record with the integration platforms and so on. But each organization has unique requirements. And within that, there is a level of customization that we do for those organizations. So yes, whilst we have strengths in manufacturing and mining, we certainly are capable of managing services organizations or any other organizations, because the core application is certainly there. What really is required is additional customization for those customers.
Now, that core application is also part of a platform, if I
Absolutely.
understand correctly.
Yes.
Let's talk a little bit then about deploying this in terms of cost. One reason this has more been a norm of large manufacturers and mining houses is they need to do it, but they could also afford it.
Yeah.
And other guys kept away because it was too complicated, unaffordable. How has this dynamic changed?
So, as I said, the solution is a hosted solution. So, many of the larger organizations prefer to maintain and host the applications themselves. For those smaller organizations, we offer full hosting and compliance in terms of security and confidentiality and all of that. And from that perspective, the cost is certainly brought down to enable small organizations to make the investment in this sort of system. So we do cater across the quantum of small organizations. So I must just mention at this point that occupational health, a lot of it is outsourced to third parties, and many nurse-based organizations are out there as well. And we cater for that market as well. It's a small market, but they offer a very valuable service for smaller companies, companies that have less than 100 employees and so on. And pretty much the same tools that we have, that the larger organizations have access to, these smaller companies have as well. So we're seeing a greater uptake by the small organizations and starting to move towards digitization of their processes, which in essence our solution does.
So you have the technology, you can obviously deploy it, and it makes sense at that level, but as we know, the saying goes, people, process, technology. What about change management? Because getting some workplace cultures to adjust to these new things is often harder than getting technology itself. James,
you've touched on an absolutely important and vital bit. So part of the process each of these deals are managed as a project, and that within that project, there's obviously certain deliverables and so on. But key to that is the actual, once the UAT has been signed off by the customer, is the actual process of ensuring that we are supporting the change management process. Because it's very difficult for doctors who've been using pen and paper for many, many years, suddenly having to move into a digital space, using electronic signatures, using tools that they've never been accustomed to before. So that change management process is absolutely vital. We offer that as part of our service, and it goes a long way in ensuring that the take-up and success of the solution is ensured.
Thank you very much, Dilip. And unfortunately, like that, 40 minutes are done. I'd like to thank Dilip Naran, Strategic Business Development Manager, and Andrew Brown, Operations Executive, both from Altron Health Tech. Thank you very much for your time today.
Thank you very much, James.
Thank you.
Thank you.
Thanks.